In London's inner city, a psychiatric team is trying to treat patients in the community. Over the past 12 months, the team and patients have allowed unique access to the normally closed world of psychiatric care. This is George's story.
I was going mad. I was just hearing voices, like telling me I'm going to hell, and voices telling me that I've got to commit suicide to go to hell, and that if I don't, then I'll be shot, and I won't have any existence at all. Afterlife or anything, but the voice saying if I go hell, then for a couple of centuries I'll come through, and I didn't know what choice to make, so I decided to go to hospital. On the day I went to hospital, I felt really freaked out. I never felt freaked out in my life like I felt then. I felt like I had a dagger in my back and a claw in my shoulder, and I was hearing like really evil voices.
A regular drug user, George Marks had downed a mixture of alcohol and ecstasy tablets. At Casualty, he showed all the signs of drug-induced psychosis, hallucinations, voices, and loss of touch with reality. So he was transferred to Springfield Psychiatric Hospital.
I was just dabbling with all sorts of drugs, really. And I've had a bit of smack and cocaine. And I did loads of LSD trips. And I've done quite a lot of these in the last couple of years.
Psychiatrist Professor Tom Burns heads the mental health team that will try to unravel George's story. His commitment to psychiatry stems from his teenage years.
Initially, I wanted to be a psychoanalyst. And then when I was a few years older, my mother had a number of breakdowns. She had a lot of very severe depression. And I think I experienced what it was like to live with that. I think I also formed, perhaps rather early, an idea of what distinguished a good team from a bad team, which brought me into it. But emotionally, I think it was seeing my mother's illness which made me, feel very committed to it.
Right. Review George.
Relatively few people who take drugs become psychotic. For those that do, like George, there are often deeper reasons, and Professor Burns is keen to investigate. His first move has been to get his junior doctor, Rob Bale, to calm George down with chlorpromazine, an antipsychotic drug which should reduce his symptoms.
Right. Well, let's go in and get this written down.
I'm going to laugh.
Now it's time for Dr. Bale to try to find out more about George Marks's state of mind.
Coming back to how things are at the moment, George, what's your mood like at the moment?
I feel lost.
How long have you felt lost for?
I feel hopeless. I feel like I'm in a prison in my mind, and I'm trying to find an escape.
Can you see yourself escaping?
Pardon?
Can you see yourself escaping?
Are
things getting better?
Feels like things are getting worse.
Does it get so bad that you wished you didn't wake up in the morning?
I thought about that one last week when the voice told me to end it all.
Yeah. Well, the voices kept on telling you that since I last saw you.
No.
The honest answer is I'm not sure exactly what the illness is at the moment. It may just be due to the drugs, it may be other things. I want to see how things go on the medication, get to know you a bit better before we decide exactly what's happening, and see what happens with your mood as well.
It's difficult to make an instant diagnosis. As Dr. Bale picks up more clues about George's life and past, he's beginning to worry. What appeared to be a case of too much ecstasy may this time be something far more serious.
Working diagnosis to start with on what he's told me is a drug-induced psychosis. However, he also gives a history of about 10 years of being quite lost and drifting, going from squat to squat, not having a job, using a lot of drugs, quite isolated, suggesting that there may be more to it than just a drug-induced illness.
I think it can be turned out in 5 days. He actually looks...
All cases are discussed before Professor Burns's multidisciplinary team at their weekly meeting. Professor Burns will listen to what his team have to say before he meets the patient and makes his own final diagnosis.
George Marks, a 26-year-old single man who came in last Thursday evening complaining of hearing of God and the devil. At that time he stated he'd been hearing God and the devil approximately the last 2 weeks after taking some ecstasy, 3 ecstasy tablets. He does, however, describe hearing voices for approximately 3 years, hearing a voice in the back of his head guiding him because he says he's not very clever and he needs a bit of help and this voice guides him. He's unsure how this voice got to be there or whose voice it is, but normally it's quite pleasant and guides him up until 2 weeks prior to admission when it said frightening things to him. It told him to harm himself, told him his mother's going to be cut up, told him that people are going to pour petrol through his mother's front door and set fire to it. And that's the main thing that he actually presented with.
So the increase in the voices and their unpleasantness, was that prior to the ecstasy or
No,
after?
it was since the ecstasy.
Since the ecstasy. Right.
And that was all he could really say about what's currently happening.
Okay. When he first arrived here, it was very much as Rob was describing him, absolutely terrified. He was convinced that people were going to do his parents harm. He wanted to phone them every 10 minutes. He wanted me or anybody else with a car to pop in and see them to make sure they were okay. Voices were distressing him. He was talking a lot about his girlfriend. However, within just the last 3 or 4 days, he's calmed down remarkably. It almost seems like, I know there's a question of like the 3 years before, but it seems like classic drug-induced reaction and a classic recovery as well.
Well, that's good news then.
Yeah.
You understand the issues. I mean, the issues, often it's quite difficult to know whether people take these drugs because they're drifting and trying to find themselves in the world, or whether the illness is just caused by the drug. Anyway, the important thing about a drug-induced psychosis is good news, if it really is that. The problem with that has been that there's been a tendency sometimes to overdiagnose drug-induced psychosis, and people are actually quite ill.
How long do we expect disturbances associated with ecstasy to last? Because I just don't know.
Well, I don't know either.
I think the answer is nobody knows, isn't it?
But certainly the reports, and I've heard anecdotally, are of short-term disorders.
Because just 10 days almost seems quite a long time.
Yeah, well, sounds gloomy. Right, we ought to see
He's
him.
on clopramazine.
How much?
Professor Burns and George Marks are about to meet for the first time.
Well, the first thing is I want to hear what's been going on in their life and what their problems are. And to some extent, the patient is the best judge of what their problem is, and they will tell you what their problem is. The other thing I want to do is make a psychiatric diagnosis. So we do what's called a mental state examination, which means that we assess their functioning in terms of their mood, their thinking, their memory, and the content of their thoughts.
Nice to meet you.
Nice to meet you. Rob's been telling us a bit about what's happened. Gather from Dave you're feeling a bit better now.
Yeah. I feel a bit more normal than I did before I came in.
Right. So you began to feel abnormal, unusual, about 3 weeks ago or 2 weeks ago, is that right?
About 12 days ago.
About 12 days ago. And what exactly...
About 2 days that just got really heavy in my mind.
Right. Well, when you say really heavy, what exactly happened?
I was hearing like voices.
Right, you were hearing voices.
Sound like the devil, God, and...
Right. And they weren't pleasant to you?
No.
No. They're frightening?
Very frightening.
Are you still hearing those voices?
Not really, but maybe a little bit,
A little bit.
just here and there.
So you've had occasionally hearing voices for a long, long time. Is that right? How long?
About 3-4 years.
3 or 4.
But not that noticeably.
But you could hear
Until
them
last
clearly,
week.
could you? And you could hear what they were saying? Has it always been the same people speaking?
I think so.
What do they actually say?
But they talk about me, and like once I brought a sandwich and the voice was saying, "There you go again, just buying horrible food for yourself."
Right. And that voice saying, "There you go again, buying horrible food," was that a year or two ago, or was that...
Yeah, that was
Right.
about 2 years ago.
So they
yeah.
comment a lot on what you do?
Yeah.
Yeah. And you're sure that you've been hearing that sort of thing long before you took these drugs a couple of weeks ago?
Yeah, more. It was more sort of. It didn't get to me so much. It was just very vague. It felt like it was just like the other part of my mind working.
Right. I'm probably going to want to talk with you and Rob will about staying on medicine for quite a long time, because I think, personally, from the story you tell me, I think the illness has been going on longer than just the last 2 weeks. And we need to discuss in detail medication with you. Okay, good to see you. I'm
Thanks.
sure you will feel better soon.
So I feel like I need to go for walks all the time to clear my mind.
Okay, great. Well, we'll see you.
Thanks.
Nice to meet you.
Nice to meet you.
I think I work with a diagnosis of schizophrenia. I mean, it's a very clear history of classical schizophrenic voices which talk about you, and sometimes to you. Very clearly talk. And the real worry for this young man is that he didn't worry about it. That's the bad thing.
And he also doesn't attribute any of this to the drugs.
No, I think he knows.
He doesn't.
And it's better if you're more upset in the long run. There was some question about whether this was just drug-induced. I mean, it clearly isn't. What he described was hearing somebody else talking about his thoughts. And that's if you want a sense of complete invasion of your personal boundaries. That's the thing you almost only get in schizophrenia.
I suppose I just got to forget about it. Like, the more I forget about there's something wrong with me, the better I feel. If I keep thinking that I've had the voices, then the more chance the voices will come back.
Schizophrenia is unpredictable, and the sufferer can experience delusions, hallucinations, and thought disorder.
If you're suffering from a psychotic illness, in particular if you're suffering from schizophrenia, the evidence seems to suggest that if you're more upset, you have a better outcome in the long term. And that people who are very distressed by the sudden development of the symptoms, such as hearing voices and strange ideas, are often the ones who make the better, quicker recovery. The ones where the illness starts very slowly and sometimes imperceptibly and don't appear to be affected by it and almost take it for granted are the ones who often, although they seem less distressed, have a poorer outcome.
How many men are saved?
George still hasn't been told the diagnosis. It's up to Dr. Rob Bale to break the news.
How are you, George?
I feel better now. Because I forgot to take my medication yesterday and I felt fine without it. Yeah, the sun's out. I think the sun's helped a lot.
Okay. How do you explain the voices?
Um,
Getting there.
Well, it sounds like it's coming from within. at the same time, it's not coming from within, it's coming from outside.
So what do you put them down to? I mean, how did they get there? Any ideas?
I think maybe through loneliness and taking drugs and being lonely, and sometimes I think too much, and I cause a sort of game or a riddle in my head that I'm trying to work out.
Do you think the game in your head and the voices could be part of being unwell?
Well, yeah, it is to do with being unwell, because it has made me unwell.
Have you got any thoughts about what sort of illness it is?
I thought schizophrenia, but I'm
What
never
made you
really
think that?
schizophrenic. I've never been schizophrenic in my life.
How would you know if you
I've
were?
always been quite stable anyway,
How would you know if you were schizophrenic, George?
by
What would tell
hearing
you?
voices. But I think real schizophrenia is when voices are from outside. But once or twice I did hear a voice from outside. But mostly it's like it's inside my head. I know it's inside my head, but it's like being possessed by an evil spirit. Or
And one of the things I wanted to talk to you about today, George, is what we think is wrong. And we do think you're unwell at the moment. And from what you've told us, I think you've probably been unwell for quite some time, but it got much worse just before you came in, possibly because of the ecstasy you took. And the thing that we think is wrong is, as you say, is actually schizophrenia. And you describe your thoughts about schizophrenia, how normally it's the voices outside people's head, and that suggests schizophrenia. That can be one part of it, but having voices inside your head, feeling you're possessed by evil spirits, can also be part of schizophrenia. And some of the other things you've described to us, the difficulty getting on with people, the feeling antisocial, feeling that you don't fit in, people are picking on you, would all fit with the build-up to becoming unwell and to suffering from schizophrenia. Well, apart from how you've already explained it to me, what else do you understand by the term schizophrenia?
I've met a couple of schizophrenic people, and they're really mad. They were just talking to themselves all day long, looking in the mirror, talking to themselves if there were another person in the mirror. And I know I'm not as bad as...
And what are your thoughts
people
when I
are
say
saying.
that I think you have got schizophrenia?
I think... Well, if I am schizophrenic, I've only just developed it lately.
Well, I think you've had it for as long as you've had the voices for. I think it's got worse lately, but I think you've probably had it for quite some time.
I think it was actually quite difficult to tell George because he was remarkably accepting of everything I said, and I suspect that he really didn't take in the full meaning of what I was saying. He kept talking about being properly ill and what have you, and I suspect that he doesn't quite believe what I'm saying, which is a reasonable reaction to being told something as important as a diagnosis of schizophrenia.
Virtually everybody has the right to know what we think is wrong with them, and in as much detail as they can cope with, because these are lifelong illnesses, many of them. They can't depend on doctors to tell them what to do all the time. They need to be engaged as active participants in dealing with their illness. It affects different people in different ways, and the problems that some people have are very different to the problems other people have. For instance, I have patients who don't find the voices a problem. They hear the voices, that's not a problem for them. For them, the problems of the illness are, for instance, their thoughts get occasionally jumbled, perhaps, or that they can't think as focusedly as they'd like to, or even that some of the side effects of the medicine they see as stigmatising, like, for instance, the sort of movements of the hand that you sometimes get with. So you've got to take seriously what they think is important. But on the other hand, they need to understand why we think you should take medicine, even when you feel well. So if they don't understand it's an illness, they're not going to take the medicine.
Though George doesn't really believe his diagnosis, he's taking the medicine in the hope that the doctors will say he's well enough to go home. life on a psychiatric ward isn't easy for him.
Quite influenced easily by other people. Like, if I stay there too long, I could end up sort of even more mad. Basically, I got an urge to go back home and put all the missing bits of a jigsaw puzzle back together and complete my life.
Just 19 days after being admitted, with the medicine taking effect, George was well enough to leave Springfield Hospital.
George is being discharged fairly early because of a number of reasons. First of all, his home circumstances are supportive and stable. He lives in a hostel, so that's good news for him. Secondly, he's responded well to treatment. His symptoms are getting better, and he's formed a good relationship with us. He knows he's been ill. He wants treatment for it. He's prepared to take the medicine. So we're able to support him well at home. And thirdly, he doesn't like being in hospital, and that's not surprising. If you suffer from schizophrenia, one of the things about being schizophrenic is that you're very sensitive to other people. And there's an awful lot of people around on an admission ward. And one of the things that we know helps people with schizophrenia stay well is being able to go off and be on their own.
The other key to staying well is taking the medicine. The problem is that George is loath to accept his diagnosis, particularly because of its associations.
I used to live with someone who had schizophrenia, and I've never seen anybody so mad. He was like coming into my room and like looking at the mirror and talking to the mirror like he was talking to someone else, and he'd be talking to himself non-stop. He'll be shouting and he'll be like murmuring and talking, and then he'll insult people and do some crime, and then he'll end up in prison and in the loony bin. I don't believe I'm schizophrenic, and I think doctor was probably being a bit too dramatic.
To help him establish a daily routine, Professor Burns' psychiatric team have arranged for George to attend a day hospital at their community centre in Battersea. He goes there every morning, returning home at night. So far, he's continuing to take the medicine, and the voices are becoming less frequent. But he's still worried and confused. A week after his discharge, it's time for an appointment with Professor Burns.
Sometimes I feel more sorted out, but lately all the time I don't feel sorted out at all. But some days I feel like I can challenge the world, and but then I think, how can I challenge the world if I feel lost? I just feel so wrapped up in what I'm thinking about, that I feel shocked. I feel walking around in a shocked sort of state.
Yeah.
Where someone will be talking to me and I wouldn't be able to listen properly because I'll be feeling shocked about myself. Because
I think that's one of the things about, George, this illness, that you withdraw into yourself. You get fully taken up with the thoughts and completely preoccupied in it. It's hard then to sort of relate to the people around you. And I think you're doing that much better than when I first met you already. You know, because you were really completely sort of lost in that sort of inner world when you came into hospital, weren't you?
yeah,
So that will get better, I think. But we're moving in the right direction.
it's just a worry of I feel like I keep thinking something bad's going to happen to me.
Something bad is going to happen.
To me, yeah.
Well, I don't think it is. I think, you know, you're beginning to get better slowly. Okay, great. So I'll see you in the next couple of weeks. And keep taking the tablets, as they say.
Yeah.
Right.
Well, I feel a bit paranoid, but hopefully I'll try and get over it.
That'll get less. I'm sure that'll get less. Good.
Okay.
Right. Well, I don't think he's there yet about coming to terms with it, to be honest. I think that it is a sense of confusion about beginning to sort of surface from being this totally preoccupied with his inner world and beginning to realise there's an outer world as well as the inner world, and how do you cope with the input from outside? Because when he came in, he was totally preoccupied with what was going on inside his head. Now he's actually still quite preoccupied, like when he said when he thinks deeply, and then he's having some of these very strange experiences. And then he also has to cope with the world outside. I think that's what he's talking about. He's not actually beginning to think, goodness me, I've been very ill for a long time. The other thing he describes is this fear of something dreadful happening, what the Germans call Tremor, stage fright, the feeling that something awful is about to happen. And that, you can understand that. If your way of seeing the world is being altered by your illness, then you're suddenly trying to make sense of it. You think, what the hell is going on? And it's very frightening. And it's that feeling that something awful, catastrophic is about to happen. And I think he's still getting a bit of that.
Some days I'm alright, and some days they come back. And it's just like people's voices, like talking about me. I don't know, I still hear them, but they're a bit more controllable. Whereas on the day I went to hospital, they were really uncontrollable.
People who suffer from schizophrenia are doubly handicapped. The first thing is it often starts young, late adolescence, early 20s, just at the time when when you and I are refining our skills about how to get on with people, how to get jobs, how to mix with people in the office and all that sort of thing. Just when we're doing that, they're completely out of it because they're dealing with a very serious illness. So there is another issue to it, however, and that is that there's some suggestion that the actual central quality of severe schizophrenia is an inability to relate to other people, to pick up the social cues, to form close, sustained relationships.
I don't reckon I'm schizophrenic, I'm just got myself in a bad phase. And I've just I'm not seriously ill, I'm just got a lot of catching up to do. As soon as I've sort of sorted my life out, I think I'll be alright.
What kind of catching up do you mean?
Getting settled down with a wife and having a job and being a happy person. Needs tuning, I think.